All right, so I go into my oncologist office, my first time meeting him, never met him before. Did research on him, and that's another good thing to do prior to meeting your oncologist. Do research on your oncologist. Look at their background, see what they've done, see what schools they went to. You know what I mean? Just try to get an idea. I looked up health grades. I'm good. I will go on reviews for anything in a moment, like in a minute. I went on health grades. I went on different websites that give reviews on doctors and what patients thought about the physicians and how their bedside manner is, how their care is, how they treat their patients. And that's something that I definitely suggest to any and everyone in any type of healthcare, anything. I mean, your PCP, primary care doctor, look them up. Look up your cardiologist if you have high blood pressure. Look up your endocrinologist if you have endo or adrenal glands, anything like that, doctor. Look up your nephrologist for kidneys. Look up your pulmonologist for your lungs. Whatever specialties of doctors you deal with, look up their reviews. Look and see how long it took to wait. Look and see how the patients, what the grade the patient gave them. Look and see everything, the great reviews and the not so good reviews if there are any. Familiarize yourself with your doctors. That is very important. This is a team effort. This is not a thing where they tell you what to do and you do it. This is a thing where you're empowered. You want to be a team with your physician, and they need to be along the ride with you as well, so that you all are in this together. You're not in this by yourself. You should always have a say-so in any care that you receive outside of cancer, and even with cancer. Anything. You need to make sure that you're comfortable with your doctors. If you don't like your doctor, you need to find another doctor. Period. If you don't like your doctor in any field, you've got to find another doctor that fits you, that will listen to you, will listen to your concerns, and take them seriously. All right, let's get back at it. So the first thing that my oncologist and I discussed after greeting each other and hey, he presented me with my surgical pathology report. My pathology report, which I have right here, literally stated what type of breast cancer I have. So I had breast right mass core biopsy results, malignant, invasive ductal carcinoma, grade 2 of 3. That is what I had. And it talked about, the different things, okay? And on the back of this pathology report, it actually gave, based off of my labs, based off of the biopsies, my Ki-67. Now, we talked about that in a previous video. Your Ki-67 actually tells you, it's supposed to predict the likelihood of that breast cancer returning to you. Okay, anything over 30 or 33 is not good, which means it's gonna come back. Okay, and my Ki-67 was 37. Okay, which interpretation was unfavorable. That means that it's going to reoccur. Okay, the reference ranges for Ki-67, 10% is favorable. So the range is 10 through 19.99% is favorable, which means that it's a great chance it won't come back. Borderline is around, greater than 20. That 20 is like borderline, really. But mine was a 37%. So that means it was going to come back. Okay. That was very interesting for me. It also gives your groups. It talks about your, your different types of hormones. Progesterone was 0. Estrogen receptor, progesterone receptor, those were 0 for me. Like I said, I was triple negative, and my HER2, the ratio was extremely, extremely, extremely low to nothing. Okay. So that's how we knew for sure that, I needed to do something, and we need to do something quick. And then it also broke down. Next step is, of course, my stains. Now, these are my actual stains, you guys, okay? So I'm going to try to explain these the way that they were explained to me. What my oncologist stated that he did was, and I'm going to show you these, okay? What they did was, when they took the biopsies from your original biopsy, right, your ultrasound guided core biopsy that I had to get, They took those biopsies and they tested them. This is what you've been waiting on, is these results. These results are going to tell you if you are estrogen positive, HER2 positive, progesterone positive, or if you're triple negative, right? So this is how they test them. So the first image is image 1. This is going to tell you the stains for image 1, and it tells you this is the estrogen one. This is image 1, estrogen is what they're testing right here, okay? Image 1 is estrogen, what they're testing right here. Now, what's explained to me is, you see all that purple, see all them dots? I call those radical, psychotic, crazy type of cells. That's what that was, okay? So it kind of will show you abnormal cells, healthy cells versus abnormal cells. And then on the back of this, it goes further into progesterone. So this is the progesterone. That's what that stain kind of looks like. And then this stain is my Ki-67, which is giving the return rate. And this one right here is my HER2. So as you can see, this is the original one. Like, okay, this is what it looks like. Okay. Then we move over here. Now they're going to test for estrogen. Look how thin my estrogen is. Look, there's nothing there. Negative. There's no craziness going on over there. There's no crazy purple, crazy psychos, right? Then we're going to roll it on over to my progesterone. This is how they can tell what you are. Progesterone. Look at my progesterone, y'all. Right here. She like, child, nah, it ain't happening. And then we get over to my HER2. Ain't nothing going on. Barely. And then we're going to look. So we know at this point, the pathologists know at this point, she's negative on all three of those. So she's triple negative, right? And then now we're going to look at the return rate. The return rate, you see how many dots those are? The dark dots, the darkest dots? That is the return rate. That's how they get this 37%, which means that it's going to return. There's a great chance it's going to return. So that's how those were explained to me. And it's important to be able to see what they saw in order to get the diagnosis that you have, right? All right, so there's that. Then I was given an anatomy of the female breast, which this is his scribbles on this as well. So mine was ductile, right? So that means this is a human breast. It was in my duct. Okay, it was in my duct. So that's where mine was. Depending on where yours is, he wanted to just show me this is where your duct is and this is where it is. Okay. Then we started going over triple negative. And this is all of the things that I was given. I'm not going to go over every pack because it was packets of information, which I'm so thankful my oncologist is amazing. All oncologists are really, really good. They're extremely smart. You have to be in certain fields to be extremely smart. Everyone is smart, but oncologists really have to really know their stuff, right? So then he gave me this. This is my triple negative breast cancer information sheet. It kind of gives me information on like what percentage when they use certain treatments. So this is triple negative breast cancer, and it goes into the breast cells. It talks about chemotherapy followed by surgery, and this type of treatment, which is for triple negative breast cancer people, the response at time of surgery is usually 64.8%. Now, let's get this clear. This was 2022. We're in 2025 right now. So at this time during that year, this is the publication that they were saying, although it says 2020, but yeah, it been no new research that showed anything different. I'm gonna say it like that, right? So there hadn't been anything that new, but it shows you the difference between the two. It tells you he broke all this down to me. Then he went on to give me more information about the type of breast cancer that I had from the National Comprehensive Cancer Network, and then gave me all this information about my different staging, okay, where I was at the time, what it meant. This is all his scribbling. He drew me a picture. So he gave me a lot of information on different types of treatment, things that I needed to do because I was triple negative, and how the FDA approves this type of treatment as of July 26, 2021, for high-risk early stage triple negative breast cancer, which is known as TNBC, in combination with chemotherapy and the immunotherapy is really what that means. It's continued that, it gives a really good outcome for surgery. So he gave me a lot of that kind of, those packets for me to kind of go over in my spare time. And then, of course, he gave me this. This is from cancer.net, American Society of Clinical Oncology, which gives even more information and more information on the back. So this is some of the information that you may receive, and also breast cancer packet, y'all. This has a lot of information on breast cancer from cancer.net as well. It's doctor approved patient information, and it gives you different types of breast cancer and other, cancer genetics and grades and stages, surgery, radiation, chemotherapy. It gives you all the information that you're going to need to kind of research, kind of look into stuff to give you further knowledge and empowering you more where you're educated to go through this journey. Okay, so this is the information and some of the information that I showed you that I was provided, because I had already done the research based off of the information that I was provided by my nurse navigator, and going on those websites on my own. I already had a plan. Okay, you guys, I already had a plan of what it was that I wanted to do in different scenarios. He also gave me another great patient resource, which is called Breast Cancer Resource Guide. Okay, he gave me this, which gives more information on different facilities where breast cancers fought in different areas. Because some people decide that they want to go to this facility in this state, which has a really more innovative way of treatment. So he's provided me with things. He provided me with things that was holistic as well. Like, okay, some people don't want to go to do chemotherapy. Some people want to take the holistic route. Some people want to do the therapy that doesn't involve the whole body. It only involves the area. Okay, so there's places in different states that actually do different types of treatments. They have every state listed in this pamphlet. This is a patient resource, 10th edition breast cancer resource, which was for that year. So look up different facilities as well on different treatment options that you have. Like I said, it may not be, everybody's different. Everybody chooses to do different things. You have every right to do that. Again, it's, really look at the amount of time you have, if the disease is further along, or if it's something that is in an early stage where you can really have more time to kind of go over everything and all of your options. And there's a lot of options, you guys. It really is. Don't overwhelm yourself. For me, because of my medical background, because I was a bit more aware medically, and I had friends with breast cancer as well. Some of them fought the good fight and survived. Some of them did not, depending on what they had. And so I was aware in different ways of different types and what I wanted to do. I had to make that decision. No one else made that decision for me. I made the decision to go the way that I went. I already knew for me that once, if I did get diagnosed with triple negative breast cancer, it's another piece of information on that, and they call this the patient resource, that I would have a double mastectomy without reconstruction. I already knew it. I walked in with already that plan if that was the case. And for me, it was, unfortunately. At the end of my appointment with him, I saw the questions that I needed to ask. He didn't rush me. He was not impatient. He was very patient, very understanding. He understood the position that I was in. And for God, Lord, I was so thankful that I had the privilege of having a doctor, a provider, who cared about how I felt, about my concerns, about my questions. He answered my questions. He answered my angel's questions. She was asking questions because her breast cancer was totally different from mine. So her treatment was completely different than my treatment. Once I made a decision in that room, he thought that I wasn't, as most patients are not so prepared, or I already knew what I wanted to do based off of what I got diagnosed with. He thought, okay, you need to think about it. I'm like, no, I don't need to think about anything. I already thought about it. I already researched it. And this is what I want to do. I want to go ahead through with chemotherapy. At that time, he explained to me, okay, for triple negative for you. He was shocked, first of all. Let's go back. He was shocked that I was like, okay, that's what I want to do. I've already researched it. I already looked it up. I already knew. And I showed him my notebook. If it was this is what I'm going to do. If it's this, I already knew. He was very shocked that I was already made up in my mind. I didn't have to sit and think about it. I knew how aggressive triple negative was for me. And again, that was my decision. At that time, he went ahead and went over briefly with me what would happen next. What would happen next for me is I would meet with my general surgeon, and then I also will start to get set up for that surgery to have my port inserted, which is the unit that they use or give you the chemotherapy and the immunotherapy. Okay. And that was one thing. So that appointment was set up, and he also went ahead and set up my schedule for chemo. He explained to me with the type of breast cancer that I had, that I needed to have chemotherapy once a week. Because of the aggressiveness of this breast cancer, I had to be treated aggressively. It had to be treated aggressively. At the bottom of my office note, when I printed it out at home, doctors have to say this, right? It said that either the goal is to cure, but, it's a possibility that either the treatment would be unfavorable, or the disease would cause an unfavorable outcome. One of the two, right? So either it's a possibility that the treatment could kill me, or the disease could kill me. But our goal is to cure this thing, right? So for those of you that like to get copies of your medical reports, I definitely will tell anyone, get copies of everything. Get copies of your labs, your visits, get copies of any imaging you have done, because certain specialties only tend to look at certain things. And I'm just being honest, I've worked in several different types of specialties, okay? So some things sometimes can get missed in healthcare. There's a lot of patients, there's a lot of people. So advocate for yourself. When I saw that, it kind of was like, whoa, right? But he has to put that in the medical record. It has to be documented that I was informed and I was told. At that time, he went ahead and also set me up for education class. Education class took about 3 hours total to go over all of the chemotherapy medications I would be given, to give me what to expect. I had to also sign a consent form as well during that time, but we're going to go through that. Before I left, I had already had my schedule. My schedule, which sometimes looks similar to this. I don't want to give the place too much information, but it tells you what date it is, what time you're going to arrive. It also tells you what's going to be done. So my first chemotherapy said CA 15-3, CA 2729. It showed the labs I would have prior to, and it also would show what medications I would be given at that visit for my chemotherapy. So they give you a printout, and you can ask for one if they don't offer. Just say, hey, can I get a printout of that, so you can keep up with your cycles, which is something else we have to learn how to do. Another thing that he went over with me was the active and future treatment plans, just trying to give me information on this type of treatment and the different side effects I could have. And this is the consent that I actually signed, that I was told that all of these things could happen to me. Okay, so that's the first consent that you get that says, okay, I'm expecting these side effects. I cannot sue. I cannot say you made me sick. None of that. But, just making it aware. And it also says frequency, every 21 days, which means every 21 days, you get hit with all of them again. We're going to talk about that. So don't worry. We're going to get into that. But by the time I left my visit, I was... Although I was prepared, as prepared as I could be, it still was another reality check of, you have cancer, and now we got to get ready to fight. That was it for me. So then here comes my appointment with my general surgeon. So you guys, if there's any one of you who are about to go through this portion of the process, or just have come out of this portion of the process, again, remain empowered. Do not lose hope. Stay as positive as you can. I'm sorry. Again, if you need to cry. If you need to scream. Okay? You're going to have those moments. I promise you, you will. But stay positive. What I mean by that is, yes, you realize that something is happening and all of these things are coming to you at the speed of lightning. It's weird because you feel like sometimes getting to appointments, getting the answers, getting the results take forever. By the time you get to your oncologist appointment, like I stated earlier, you are going to have all the pieces to your puzzle, or you should have all the pieces to your puzzle to come up with some type of a plan that you're walking out of that door with, whether you have decided what you're going to do or whether you still need to think about it. All the options are then given to you at that time based off of all of those results. Okay, so remain encouraged, and get ready for the next steps, which will be your fight. Okay, so you got this. Hold on, be empowered. All right. And next, we're going to talk about the next steps right after that. Fight, girls, fight. You guys got this. I'm so proud of you guys.